Health Novo presents Sushruta, our health awareness channel.
Now comes the question about how to remove, how do we remove it, what exactly happens in removal. So I am going to explain to you on all the conditions how we remove the teeth normally. If the tooth is perfect, like there is no opposition and you have to remove that, that removal is not surgical removal, is a removal of wisdom teeth. It's difficult because the problem is that the wisdom teeth roots are always in the different shapes and sizes. And that is the difficulty we face even the tooth has come straight. If the tooth is angulated, then we do something called minor surgical procedure. We take the incision because the tooth is inside the gums. We take the incision and then reflect the gums. As you can see in this picture, the incision is taken, the gums are reflected, and we see the impacted molar inside the bone. So in that case, we remove little bit of bone and then we elevate or remove the tooth. Is it difficult? Yes and no. An expert doctor is removing that tooth very easily. Difficulty comes in due to the variation of the tooth size, shape and angulation. But if we take X-rays, not only the X-ray, what I just showed you, but even there are 3D X-rays available, then we can tell you exactly where the position of the tooth is. As you can see in this screen, where the wisdom tooth is, where the nerve is, and how we take care of all the things before we do the extraction. This is for the planning stage. Now you can see the wisdom tooth here. I'll show the wisdom tooth how it looks like. This is the wisdom tooth here. The nerve goes from here on the right hand side. The nerve comes from here and it goes passing near the wisdom tooth. In this case, we have to take a lot of precautions. So what we do is, we remove the bone from this area completely and then we elevate the tooth up this way so that the wisdom tooth comes out. Now the problem is when we are doing this, the nerve has to be checked in. Now in two-dimensional, we don't know the nerve is in the front or the back or in the tooth. So we require 3D X-ray also. So when we do this, we see to it that we don't damage your nerve here. We don't damage your nerve. You can see a wisdom tooth here also. Now this wisdom tooth, if it comes down and rubs against the cheek, you can get ulceration in the cheek, and that ulceration, if it doesn't heal, then you know what can happen is like a cancer or so. So to be taking precautions of that. So this is the way we can explain the patient, we can explain you where the tooth is, what we exactly do, how we remove it, and what could be the complication if at all it is there, by showing this particular system, which is a diagnostic system to show you before removing the wisdom tooth. So any position, a good surgeon, dental surgeon, but we have got specialists also called oral and maxillofacial surgeons, they remove that tooth. So even upper, lower, same procedure, incision, reflecting, removing the bone. Sometimes we actually cut the tooth into two parts because it's easy to remove. So all these are minor surgical procedures which you don't have to worry about. The most important worry is with us. Most of the time we remove wisdom teeth under local anesthesia. What is local anesthesia? Only that particular area becomes numb and half of the tongue remains numb if you are removing lower teeth, upper teeth, palate and that area, cheek area. It's not very difficult, but when we remove that tooth, sometimes patient makes it difficult for us because there is a sound coming in and patient head moves left and right, then there is a problem. Because one side is the tongue, where is wisdom tooth? One side is the tongue, other side is the cheek, back is pharynx, up is palate, down is nerve, mouth is opening only this much, and in that we have to reflect the flap, our burr comes in, water comes in, there has to be suction inside, and all these things in that small mouth. So we have to concentrate so much on that tooth, and slowly, without damaging your tongue and cheek, you have to remove the bone, cut the tooth and take it out. You require real good expertise. So that's the removal of wisdom tooth.